She has a disease for which there is no cure and is now trapped by a system that can't keep up with the latest medical procedures. Tonight, we take a hard look at how the lag time between breakthrough experiment and accepted treatment could mean a Milwaukee wife and mother ends up in a wheelchair.
So looking at you, I can see like 4 people.
33-year-old LaKesha Johnson of Milwaukee just wants to be a good wife and mother.
There's a blind spot in the middle, which is really weird.
But her multiple sclerosis keeps getting in the way.
My right leg going completely numb, where I'm dragging it all the time, like I can't feel it at all.
Diagnosed in 2007, traditional drugs have failed her. Even chemotherapy with steroids, and the symptoms keep coming on. But there was new hope recently when her doctor told her she was an excellent candidate for a stem cell transplant study at Northwestern Hospital, which has shown great success using MS patients' own stem cells.
Their neurologic disability reverses, and in fact, even though after this treatment they're on no therapy for MS, they improve neurologically at 6 months. They're better at 1 year than 6 months, and their maximum improvement is 2 years after the procedure, with reversal of what had otherwise been ongoing neurologic deficits.
Dr. Burt says hundreds of patients from around the world have come to his lab to take part in the study. The cost, $125,000.
Well, most insurance companies pay, and Medicare, which is federal, and Medicaid, which is state here in Illinois, they pay. So it is the rare insurance company that won't pay.
And it just so happens that LaKesha Johnson's provider is one of those rare exceptions.
This is a process of just getting certain people who have put blinders on and have just said no to be able to listen. And for this particular insurance company, I've repeatedly said I'll come, present data, talk, answer questions. Those offers have never been accepted.
It's crazy because the letter that I got the first time is just about mimicking the same letter I got every last denial.
It was then at the urging of a friend, when she was feeling her lowest after yet another chemo session, that Johnson did something she never imagined. She went public with her private struggle.
But it's so far away.
Going on YouTube to ask for money.
This all started in April, May. It's now December, and my episodes are almost weekly.
So I actually haven't watched it since I did it, actually.
Why?
It's sad. I know it's weird because it's me, but hearing the story is probably harder for me than actually saying the story.
She calls her blog Johnson's Footprints, and between friends, former classmates, and strangers, she's raised $12,000.
I'm hoping that this will get out to the right people.
While encouraged, Johnson's husband knows they've got a long way to go. He uses his wife as inspiration not to feed into the anger, and while we visited with them, looked straight into our camera and had a message for the powers that be at Blue Cross Blue Shield, Minnesota.
This is eating at our family. Imagine this being your wife, your daughter, your mother. I mean, it's different when the shoe was on the other foot. If it was you sitting in my position, you would want this done.
The Johnsons are insured through Anthony's work, and they tell me they don't want to lose the coverage they already have, but they do point out the cost of the chemo treatments has already surpassed the one-time cost for the transplant. Blue Cross Blue Shield of Minnesota released a statement telling me in part that the procedure is investigative. Should future studies indicate that such stem cell procedures meet the same safety and efficacy standards as proven treatments, our policy may be revised to reflect such findings. Dr. Burt wants me to convey to them he is ready to provide his proof, and he hopes they'll come around in time to help LaKesha. We've got the complete Blue Cross statement and a link to LaKesha's blog on our website, cbs58.com.